Hello students, welcome to EPG Pathshala. I am Dr. Prasanna Kumar Patra from Utkal University Bhubaneswar. Today we will discuss about the module Basic Principles of Epidemiology from the paper Physical or Biological Anthropology. So students, let us see what we are going to learn from this module. First, the basic principles and concepts of epidemiology, the brief history and applications of epidemiology, about various epidemiological approaches, and about the disease occurrence and its transition, and the various functions of epidemiology. Epidemiology is a basic science of public health. The term epidemiology has come from a Greek word called epi, means among or upon, demos means people, and logi is to study. Therefore, epidemiology is concerned with what happens or occurs to a particular population. Epidemiology is based on scientific methods, inquiry, including the systematic collection of data, its analysis, and meaningful interpretation. As the basic science of public health, epidemiology includes the study of the frequency, patterns, and causes of health-related states or events in populations, and application of that study to address public health issues. There are different definitions of epidemiology, but the definition by John M. Last in the Dictionary of Epidemiology 2008 5th edition is most relevant. It has defined epidemiology as the study of distribution and determinants of health-related states and events in population problems. The components of definition such as distribution, determinants, and health status specific populations reflect a deep meaning. The term distribution denotes the frequency and pattern of health-related events in a specific population. Frequency not only shows the number of these health events in a particular time period, but also the relationship with the size of population, whereas pattern refers to the occurrence of health-related events by time, the seasonal, annual, monthly, weekly, daily, etc. Place means geography, urban, rural, and work sites, and persons include demographic factors which may be related to risk of illness, injury, etc. The term determinant denotes to any factor, whether event or characteristic, that brings about a change in a healthy status. Many factors combine together to affect the health of individuals and communities. Whether people are healthy or not is determined by their circumstances and environment. To a large extent, factors such as environment, genetics, income, education, level and relationship with friends and family all have considerable impact on health, whereas the more commonly considered factors such as access and use of healthcare services often have less impact. The determinants of health include the social and economic and physical environment and individual characteristics and behaviors. World Health Organization's Health Impact Assessment has given this. Health-related events in specific populations may be seen as anything that affects the well-being of a population and not only the disease. Brief history of epidemiology and its applications. Epidemiology as a discipline came into being after the World War II. However, its evolution may be traced back to the work of Hippocrates in 400 BC, who has suggested that environmental and host factors such as behaviors might lead to the development of disease. John Grant in 1662 has published a landmark analysis of mortality data, including patterns of birth, death, and disease occurrence noting disparities between males and females, high infant mortality, seasonal variations, and differences in rural and urban areas of residence. In early 19th century, William Farr built upon Grundt's work by systematically collecting and analyzing Britain's mortality statistics. John Snow in 1854 conducted studies of cholera outbreaks in the Golden Square of London, both to discover the cause of disease and to prevent its recurrence. His work illustrates the classic sequence from descriptive epidemiology to hypothesis generation to hypothesis testing, that is, analytical epidemiology, to application. He found that water as source of infection for cholera. After the above studies, the epidemiological methods began to be applied in the investigation of disease occurrence and in public health management. The purpose of epidemiologic investigations. The main purposes and objectives of epidemiological investigations are to determine the extent of disease problems in the community, to identify cause of disease and mode of transmission, to study natural history of disease, to develop basis of preventive programs, to evaluate new preventive and therapeutic measures and new modes of healthcare delivery, and to provide basis for public policy. The assessment of health of a community is made by analyzing the data by person, place, and time. For example, what are the actual and potential health problems in the community and where are they occurring? Which population in at increased risk of disease? Epidemiologic study influence the individual's decision to understand the complete history of any disease and its trend in population, to identify the cause of increased risk factors, helpful in taking appropriate public health action might be taken. Milton Torres in 1992, a leading exponent of close interrelationship among epidemiology, public health, and policy, has summarized the functions of epidemiology as to discover the agent, host, and environmental factors that affect health in order to provide the scientific basis for the prevention of disease and injury and the promotion of health. Determine the relative importance of causes of illness, disability, and health in order to establish priorities for research and action. Identify those sections of population which have the greatest risk from specific causes of ill health and benefit from specific interventions in order to that the indicated action might be detected appropriately. Evaluate the effectiveness of preventive and therapeutic health programs and services in improving the health of population. Epidemiological approach, descriptive and analytic. Epidemiological methods are used to identify the causes of poor health, measure of strength of association between causes and outcomes, evaluate interventions, and monitor changes in population health over time. The epidemiologists mainly count cases or health events and describe them in terms of time, place, and person. Before counting cases, however, the epidemiologist must decide what a case is. This is done by developing a case definition, that is, set a standard criteria for classifying whether a person has a particular disease, syndrome, or other health condition. Using this case definition, the epidemiologist finds and collect information about the patients. The epidemiologist then performs descriptive epidemiology by characterizing the cases collectively according to time, place, and person. To calculate the disease rate, the epidemiologist divides the number of cases by the size of the population. Finally, to determine whether this rate is greater than what one would normally expect, and if so, to identify factors contributing to this increase. The epidemiologist compares the rate from this population to the rate in an appropriate comparison group. Subsequent tasks are reporting the results and recommending how they can be used for public health action. Descriptive epidemiology. It covers time, place, and person. It is concerned with 5 W's, that is, what health issues of concern person or population, who the person, where the place, when about time, and why and how, that is causes, risk factors, modes of transmission of disease. Data collection and analysis by time, place, and person is desirable as it helps in establishing causal relation and pattern of disease. The occurrence of disease changes over time. Some of these changes occur regularly, while others are unpredictable. For diseases that occur seasonally, health system can anticipate their occurrence and implement control and prevention measures. For sporadic diseases, studies can be conducted to identify the causes and modes of spread and then develop appropriately targeted actions. The pattern of disease occurrence by time is critical for monitoring and health interventions by the government. Analytic epidemiology. Descriptive epidemiology is concerned with what, whereas analytic epidemiology is concerned with why. Thus, descriptive or description is what leads to analysis, why, as good description provokes the why. As mentioned earlier, descriptive epidemiology can identify patterns among cases in populations by time, place, and person. Epidemiologists use descriptive epidemiology to generate hypotheses and analytic epidemiology to test the hypothesis. The key feature of analytic epidemiology is a comparison group. When investigators find that persons with a particular characteristic are more likely than those without the characteristic to contract a disease, the characteristic is said to be associated with the disease. Thus, analytic epidemiology is concerned with the search for causes and effects, or the why and the how. The hallmark of analytic study is the presence of at least two groups, one of which serves as a comparison group. Epidemiologists use analytic epidemiology to quantify the association between exposures and outcomes and to test hypotheses about causal relationships. There are two types of epidemiologic studies, that is, experimental and observational studies. In an experimental study, the investigator determines through a controlled process the exposure for each individual, as clinical trial, or community, that is, community trial, and then tracks the individuals or communities over time to detect the effects of the exposure. In an observational study, the epidemiologist simply observes the exposure and disease status of each study participant. The two most common types of observational studies are cohort studies and case control studies. A third type is cross-sectional studies. Cohort study. In a cohort study, the epidemiologist records whether each study participant is exposed or not, and then tracks the participants to see if they develop the disease. It differs from an experimental study because the investigator observes rather than determines the participants' exposure status. After a period of time, the investigator compares the disease rate in the exposed group with the disease rate in the unexposed group. The unexposed group serves as the comparison group, providing an estimate of the baseline or expected amount of disease occurrence in the community. If the disease rate is substantively different in the exposed group compared to the unexposed group, the exposure is said to be associated with illness. These studies are sometimes called follow-up or prospective cohort studies because participants are enrolled as the study begins and are then followed prospectively over time. An alternative type of cohort study is a retrospective cohort study. In this type of study, both the exposure and the outcomes have already occurred. Case control study. In this study, the investigations start by enrolling a group of people with disease and another group without disease. This is controlled. Investigators then compare previous exposures between the two groups. If the amount of exposure among the case group is substantially higher than the amount of control group, then illness is said to be associated with that exposure. Cross-sectional study. Under this, a sample of persons from a population is enrolled and their exposures and health outcomes are measured simultaneously. The cross-sectional study tends to assess the presence or prevalence of the health outcome at that point of time. Disease occurrence and transmission. It has been observed that disease and other health events do not occur randomly in a population, but are more likely to occur in some members of the population than others because of risk factors that may not be distributed randomly in the population. A number of models of disease causation have been proposed. Among the simplest of these is the epidemiologic triad or triangle. It consists of an external agent such as virus, bacterium, parasite or other microbe, a susceptible host that is human being, and an environment that brings the host and agent together. In this model, disease results from the interaction between the agent and the susceptible host in an environment that supports transmission of the agent from a source to that host. Agent, host, and environmental factors interrelate in a variety of complex ways to produce disease. A variety of factors intrinsic to the host, sometimes called risk factors can influence an individual's exposure, susceptibility, or response to a causative agent. Opportunities for exposure often influenced by behaviors such as sexual practices, hygiene, and other personal choices, as well as by age and sex. Susceptibility and response to an agent are influenced by factors such as genetic composition, nutritional and immunologic status, and anatomic structure, presence of disease or medications, and psychological makeup. Natural history of disease refers to the progression of a disease in an individual over time. Many diseases have a characteristic natural history, although the time frame and specific manifestations of disease may vary from individual to individual and are influenced by preventive and therapeutic measures. An infectious agent may be transmitted from its natural reservoir to a susceptible host in different ways. There are different classifications for modes of transmission. They are direct and indirect. In direct transmission, an infectious agent is transferred from a reservoir to a susceptible host by direct contact or droplet spread. Direct contact occurs through skin to skin contact, kissing, and sexual intercourse. Direct contact also refers to contact with soil or vegetation harboring infectious organisms. Droplet spread refers to spray with relatively large short-range aerosols produced by sneezing, coughing, or even talking. Droplet spread is classified as direct because transmission is by direct spray over a few feet before the droplets fall to the ground. Indirect transmission refers to the transfer of an infectious agent from a reservoir to a host by suspended air particles, inanimate objects, for example vehicles, or animate intermediaries, for example vectors. Airborne transmission occurs when infectious agents are carried by dust or droplet nuclei suspended in air. Airborne dust induces material that has settled on surfaces and become resuspended by air currents, as well as infectious particles blown from the soil by the wind. Vehicles that may indirectly transmit an infectious agent include food, water, biologic products like blood, and fomites like inanimate objects such as handkerchiefs, bedding, or surgical scalpels. Vectors such as mosquitoes, fleas, or ticks may carry an infectious agent through purely mechanical means or may support growth or changes in agent. Functions of epidemiology. The main functions of epidemiology are public health surveillance. It is a continuous and systematic collection, analysis, interpretation, and dissemination of health data to guide public health decision making and action. It shows the ongoing patterns of disease occurrence and disease potential so that investigation, control, and prevention measures can be effectively applied. Field investigation. The purpose of is to know the natural history of any disease or risk factors or identify the cases. It leads to the identification of additional unreported ill persons who might otherwise continue to spread infection, as in the case of sexually transmitted diseases such as AIDS, RTI, etc. Analytic studies. Analytic studies, along with surveillance and field investigation, is helpful to understand the causes and modes of transmission, which helps in taking appropriate control and prevention measures. Assessment and evaluation. Evaluation is the process of systematic and objectively determining the relevance, effectiveness, and impact of activities with respect to established goals. Epidemiologists play an important role in evaluation of public health services and other activities. Linkages. Epidemiologists work in close coordination with the multidisciplinary team of health personnel, medical and research institutions, or any facilities, and maintain linkages with them for effective output and policy development. The epidemiologists are also involved in making recommendations and appropriate interventions based on their field findings and research. They regularly provide input and recommendations regarding disease control strategies, disease regulations, and healthcare policy. So, students, let us summarize what we have learned in this module. We have learned the basic concept of epidemiology, the brief history and application of epidemiology, about various epidemiological approaches, the disease occurrence and its transition and transmission, the various functions of epidemiology. We also studied that epidemiology is a basic science of public health. We also studied that epidemiology is based on scientific methods of inquiry, including the systematic collection of data, its analysis, and meaningful interpretation. Health-related events in specific populations may be seen as anything that affects the well-being of a population and not only the disease. Epidemiology as a discipline came into being after World War II. Some of the most common applications of epidemiology are the assessment of health of a community, influencing the individual's decision to adopt healthy lifestyle, in helping in establishing the proper diagnosis and identifying the cause of increased risk factor. Epidemiologists also help medical doctors to identify the cause of increased risk factors of disease for appropriate public health action. Thus, epidemiology includes the study of the frequency, patterns, and causes of health-related states or events in populations, and the application of that study to address public health issues. Epidemiologic investigations is problem-oriented and tends towards applied research. Thank you.